Welcome to day 3 of our anterior tooth dental anatomy marathon. In this video, we're going to be going over the mandibular central incisor. And if you're just joining us, go ahead and catch up by checking out these videos on the maxillary central incisor and the maxillary lateral incisor. Let's get started. Hello, I'm Dr. Clara. I'm a practicing dentist and your new dental study coach. I'm taking mountains of textbooks and information and turning them into short, easily digestible videos to make your studying a little bit easier. Speaking of studying, are you currently studying for a tooth identification test? Be sure to steal my 5-step tooth identification cheat sheet in the description below, where I'm going to work you through a 5-step process for identifying teeth. There are 2 mandibular central incisors, the right and the left, and those are numbered 25 and 24 using the universal numbering system. The mandibular central incisor is one of 4 types of incisors. The mandibular central incisor is located at either side of the midline of the mandibular arch, so that the mesial of the right mandibular central incisor and the mesial of the left mandibular central incisor contact each other. The mandibular central incisor has an incisal ridge and no cusp. The mandibular central incisor is the smallest incisor, smallest anterior tooth, smallest tooth overall. The mandibular central incisor is also the most symmetrical of all of the teeth.
Attention dental students, while studying, look out for words like smallest and most. Those are popular test questions. Which incisor is the smallest? The mandibular central incisor. Which incisor is the most symmetrical? The mandibular central incisor.
The function of the mandibular central incisor is to cut, bite, shear food, support the lips, help with aesthetics, and help with speech. The mandibular central incisor erupts at ages 6 to 7, and the root completes 3 years later at 9 years old. The first sign of a calcification is at 3 to 4 months. Let's look at the facial surface of the mandibular central incisor. Like all incisors, the crown is shaped like a trapezoid with the larger base at the incisal ridge and the smaller base at the cervix, so that it's tapering from the incisal ridge to the cervix. The crown is taller incisal cervically than it is mesial distally. The crown of this tooth is the narrowest mesial distally of all of the teeth, and the crown is the smallest and most symmetrical of all of the teeth. Like all incisors, this tooth has an incisal ridge and no cusp. So the incisal outline is straight, very straight, at a right angle to the long axis of the tooth. At eruption, or if this tooth isn't in function, there may be 3 mamelons, or 3 bumps on the incisal ridge. These correspond with the 3 facial developmental lobes. The mesial outline of this tooth is very straight. The mesial incisal angle of this tooth is very sharp and pointed. And the height of contour is in the incisal 1/3. The distal is symmetrical, so it's going to match. The distal outline is going to be very straight. The distal incisal angle is going to be very sharp and pointed. And the distal height of contour or contact is going to be in the incisal 1/3. It's not more cervical, it's going to match the mesial. This is one of the few teeth that doesn't have the distal contact being more cervical.
Attention dental students, you're going to see lots of exception questions on your tests. In this case, we're going to be talking about the contact points. Typically, the distal contact is more cervical than the mesial contact, except for the mandibular central incisor, where the contacts are equal to each other. The other exception that you'll learn about later is the mandibular first premolar, where the mesial contact is more cervical than the distal. Example test questions. All of the following teeth have a distal contact that is more cervical than the mesial contact, except the mandibular central incisor. The mesial and the distal contacts of the mandibular central incisor are in the incisal 1/3. The mesial contact of the mandibular central incisor is more cervical than the distal contact. The first statement is true, and the second statement is false, because the mesial contact is equal to the distal contact for the mandibular central incisor.
The labial surface is smooth and relatively flat. Developmental depressions are very unlikely. The root of the mandibular central incisor is very narrow mesial distally. The outline of the root is going to be straight and match the outline of the crown of the tooth, and just continue to narrow until it reaches the apex. There is a bend to the distal at the apical 1/3, though there can be some variations where it's straight. Now let's flip this tooth over and look at the lingual. The outline of the lingual surface of the mandibular central incisor is the same as it was from the facial. Where it differs is that the lingual surface is not as smooth or regular. The mandibular central incisor has the same features as the maxillary incisors did, but it's a lot less prominent. This lingual fossa, though weak, is still bordered by the same 4 things: a weak mesial marginal ridge to the mesial, a weak distal marginal ridge to the distal, the lingual portion of the incisal ridge or the lingual-incisal edge towards the incisal, and a weak cingulum towards the cervical. The cingulum of the mandibular central incisor is centered in the crown. There aren't going to be any developmental lines or grooves to this tooth. The root and crown of the mandibular central incisor do taper lingually, so that the mesial distal dimensions narrow as you go from the facial to the lingual. It's going to be easier to see from the incisal view, but first let's look at the mesial and distal aspects of this tooth. All right, so here is the proximal view of the mandibular central incisor. This is the mesial, this is the distal. The crown is triangular or wedge-shaped with the base at the cervix and the apex at the incisal ridge. The facial outline is convex from the cervical line to the height of contour at the cervical 1/3, and then it's straight up until the incisal ridge. The height of contour is at the cervical 1/3. The lingual outline is S-shaped, convex over the cingulum, and then concave to the incisal ridge. The height of contour is at that cingulum in the cervical 1/3. The cervical line, or the CEJ, where the root of the tooth and the crown of the tooth meet, are going to curve up towards the incisal. The mesial curve here is going to be more pronounced than the distal curve. The incisal ridge of the mandibular central incisor is lingual to the long axis of the tooth. It's not centered like the maxillary incisors were. If this mandibular central incisor has wear facets from incising against those maxillary incisors, it's going to be inclined towards the facial. The outline of the root of the mandibular central incisor is going to go straight down from the cervix, and then it's going to start to taper at the apical 1/3. The mandibular central incisors root is wider facial lingually compared to mesial distally, so it's going to have a ribbon-like shape to it. The mandibular central incisor has broad developmental depressions on the mesial and distal, with the distal being more pronounced. Let's look at the incisal surface. The mandibular central incisor has a diamond shape to it, tapering from the incisal ridge to the cingulum. The mandibular central incisor is wider facial lingually than it is mesial distally. The incisal ridge is going to be positioned lingual to the center of the tooth. The mandibular central incisor has bilateral symmetry. What that means is the mesial is going to be nearly identical to the distal. The facial height of contour is centered and the cingulum is centered. And the incisal ridge runs straight mesial distally between the contact areas, forming a right angle to a line bisecting the crown labiolingually. The mandibular central incisor has 1 root and 1 canal, though a very common variation is 2 canals. In fact, 40% of mandibular central incisors have 2 canals. Those canals will be positioned one towards the lingual and one towards the facial. If you take a cross-section of the root of the mandibular central incisor, the mesial distal dimension is narrower than the facial lingual dimension. So we've been going over the typical features of a typical mandibular central incisor. And that's where we're going to leave it, because the mandibular central incisor is pretty uniform and really doesn't have that much variation. And that concludes this 3rd video of our dental anatomy tooth marathon. Be sure to subscribe, because tomorrow we're going to be going over the final incisor tooth, the mandibular lateral incisor. Till then, check out some of these other videos. Happy studying. Bye.